Well, for more on the situation in Brazil specifically, we can speak now with Anthony Pereira, Director of the Brazil Institute at King's College London. Thank you very much for speaking to us here at France 24. Now, every day this past week almost, Brazil has been reporting a new record number of infections and also deaths. How is the country's healthcare system coping?
Well, the picture is very different around the country. As you know, it's very diverse and, the situation varies. But I know in Sao Paulo, which is sort of the epicenter of the coronavirus crisis in Brazil, there are fears that the public health system will become overwhelmed. And that's true in some other cities as well, as Rio de Janeiro, Recife is badly hit, Belém, Fortaleza. What I understand from Manaus is that the numbers are starting to drop in the city, but it's spreading out to the state of Amazonas. So there's real concern that deaths are still rising from coronavirus, and that they're not clear when they can start bending the curve and getting on the right side of these numbers.
Now, Brazil's far-right President Jair Bolsonaro has repeatedly tried to downplay the severity of the outbreak. As the death toll climbs overall in the country, is that a position you expect him to be maintaining?
Well, Bolsonaro has behaved in a very strange way in this crisis. I mean, many other leaders, such as AMLO, López Obrador in Mexico, initially dismissed the coronavirus, but then they walked back and sort of fell into line with the consensus among public health experts. Donald Trump was a bit similar. In Britain, they floated the idea of herd immunity, then they walked back from that. But Bolsonaro has not changed. He doesn't want lockdowns. He dismisses the seriousness of the virus. And he's lost two health ministers. He lost a health minister in April, on the 16th of April, and he lost another one on the 15th of May. The interim health minister is a general, active duty general with no medical experience. So there's real concern, I think, amongst the general population, but also the public health specialists in Brazil, that the president's messages are creating this very confused situation where a lot of the governors are saying, you have to still stay indoors. We have to beat this spread of this virus. And the president is saying, go back to work.
So what then about Bolsonaro's popularity through all this? Are Brazilians largely happy with the direction that their president is taking?
The surveys indicate that there's about a third of the population that's still solidly behind the president. Some of those people show up at protests against the lockdown and protests against the Supreme Court and the Congress for playing the role that they've been playing. The Supreme Court, for example, ruled that for public health issues, the governors and the mayors have authority, not the president. But that leaves about 2/3 of the population, according to opinion polls, more aligned with the governor's positions and more aligned with a strict lockdown than they are with the president. So some people are speculating. I read a piece last night by José Marílio de Carvalho, a distinguished historian in Brazil, wondering whether Bolsonaro can finish out his term given the position that he's taken on the coronavirus. And so there are real political conflicts at play in Brazil, as well as the challenge of dealing with the coronavirus, which makes everything more difficult. And of course, it worries the neighboring countries.
Now, as different states debate how best to ease lockdown restrictions in Brazil, do you think there's a way for the country to strike a balance between securing the health of its citizens and the health of its economy?
Yes, I think they can. I think if you look at Europe, a lot of countries are coming out of lockdown slowly, carefully, and I think Brazil can do the same. We know that for many people, self-isolation has been difficult in Brazil because they may live in a house without running water. They may not have gotten the bailout money that was offered by the government, and so they may be living from day to day, and they feel they have to go out to earn something. But I think in general, as in many other countries, people want to do what they're being told is right to stop the spread of the coronavirus. And therefore, I think you will see cities coming out of this. As I mentioned, Manaus has had a terrible time, but it looks like Manaus maybe getting better. And I think that can happen in other cities as long as the local authorities are aligned with the kind of consensus of public health officials and not with the president. But that is the case in most places.
And we have been hearing from a lot of medical experts that what we really need now is joined up thinking between different countries of specific regions. Do you think there's any chance of us seeing some sort of joined up strategy in Latin America as far as the coronavirus is concerned?
I think that's possible. There's good public health capacity in many countries. There's good knowledge, there's good research. Testing is not necessarily going to be widespread in any of these countries, but we know from Greece, for example, and some of the Baltic countries, that you can have an effective strategy against coronavirus without massive amounts of testing. You know, in their case, they closed early, they locked down early, and they were able to avoid a spread of the coronavirus from Italy, from northern Italy, where it was bad. So I think similar amounts of cooperation can happen in the region in Latin America. I'm not sure, again, Brazil is sort of an outlier because the president is pushing chloroquine. He's very much following Donald Trump in that way. And that, again, is causing pushback from public health officials who think that the evidence is not there for chloroquine. So I'm not sure Brazil will be playing a leading role in these efforts because of the position of the president.
Anthony Pereira, Director of the Brazil Institute at King's College London, thank you very much for speaking to us here on France 24.